Looking at, I guess, mainly focusing on depression and Alzheimer's disease, and we're interested in the increased risk with people who have midlife depression and whether that contributes to Alzheimer's disease, and then looking at whether people with Alzheimer's disease obviously have depression or are more at risk of having depression in late life as well. But we're sort of talking with the clinicians at Birmingham. We're interested in whether the depression is actually reflecting the pathology of Alzheimer's disease or whether it's a separate condition as well. And obviously we're looking then at the sort of the effects of SSRIs, which are commonly prescribed for depression treatment, and how that might impact either late life depression, or for us it's more interesting actually whether the antidepressants might impact the pathology of Alzheimer's disease. And in that case it was APP processing as the sort of precursor form to amyloid beta, which is one of the key pathologies, and then also oxidative stress, which we know happens early in the Alzheimer's disease brain as well. Yeah, so the study sort of goes sort of more back, I guess, bench side, so we're moving away from like people and more into cell models. So we're really interested in using iPSC models and sort of the technology around that. So the models that we have different prostanoline 1 mutations, and we're looking at the effect of the SSRIs, so in our case it's citalopram, which is one of the more commonly prescribed SSRIs. And we're seeing how, whether we treat the cells over sort of an extended period of about 45 days, whether we can see a change in the pathology associated with Alzheimer's disease there. Some of the results that we've got sort of looking at around more to do with the sort of non-amyloidogenic processing. So APP is cleaved sort of in two pathways. We get the one side that forms amyloid beta, which is the sort of pathological pathway. And on the flip side of that, the other side, the other pathway is involved with alpha secretase cleavage and releases things that are sort of beneficial for the brain. We're really interested in the activity of those enzymes that can actually shift that pathway towards the protective side. And in our cell models, we're looking at the SSRIs actually you can sort of shift that pathway to be protective, increasing the alpha secretase enzyme and then releasing sort of neuroprotective factors and preventing amyloid formation in the cells.